Welcome to Globo's Conversations at the Lab, hosted by Globo's Innovation and Experience Lab. In this audio series, we host conversations with language access leaders, thinkers, and those driving to improve experiences for the LEP and deaf and hard of hearing communities, because we believe that language access is a right, not only a right, but a superpower. I'm your host, Francesca Mayer. Let's start the conversation. Today, I'm sitting down with Cesar Palacio, former head of language access at MD Anderson. Cesar is a thought leader on designing for linguistically diverse populations. In his time at MD Anderson, he matured their language access program and gained a reputation for thinking outside the box to ensure great patient experiences and outcomes across languages. I am also excited to be working with Cesar as council advisor for the Language Access Innovation for Healthcare Council on a mission to design a radically inclusive future for all of those across languages. Hi, Cesar. Welcome to the Language Access Innovation Lab conversation.
Hi, Francesca. I'm excited to be here. It's great to be talking to you today.
Did I get your bio right? Anything you want to add or tell our listeners?
Well, you got it right. Let me add that I have been involved in language access and the language industry since 1986. So I'm a little old, but hey, I'm always excited about the industry.
So you've gotten to see it go through all of its different phases and evolve.
Yes, I have worked on several sides of the industry. Um, I have been, I'm sorry. I have been on the agency side as well as the in hospitals. I have had experience with my own company at one point, and I have been a freelance interpreter, a freelance translator. I have done, multiple jobs in the industry. Uh,
Do you have a favorite, thinking back on all of the different roles that you've had?
My favorite has always been the medical interpreter
Mm.
role. I was a medical interpreter, a staff medical interpreter at UT Southwestern for 5 years, and I tell everybody that was my favorite job, and I really enjoyed it.
So that ties into a question that I love to ask language access leaders, because I don't think that a lot of people think of this as a career, or they don't even really know that this is something that you can progress to do. I know when I started at Globo, I didn't even really understand that language access was a thing. I had to really learn about it. I didn't know that there were companies like Globo that did this, or that it was something that health systems had to think about. And so I love to ask how you got into language access. So you started as an interpreter, and then that's kind of how you kind of got into the field. Is that what happened?
Actually, in 1986, I was a student at Texas Tech University. And I got a call from one of the Spanish professors at the university, and he said, "Hey, I know you're a native Spanish speaker, and I would like to see if you can help me with a project." And he had a contract with a government agency, and I cannot tell you which one, but it's it was an investigation that was being done in Lubbock, Texas, where Texas Tech is, and we transcribed from Spanish into English a bunch of tapes that this organization was um, taking, and that's when I started working seriously and professionally in translations. And then I had also had, I was studying biology at that time. And that experience in translations plus my background in biology translated into um, getting into the medical field and becoming a language access and healthcare specialist.
When you were a kid, what did you dream of doing? What was your dream career?
Oh, I wanted to be a pilot.
Cool. Okay. Tell me more
Yeah.
about that. Why?
Well, my dad was an Air Force pilot,
Mhm.
and I wanted to follow in his steps. And I'm a native of Peru in South America, and I applied to the Peruvian Air Force Academy. I wasn't able to get in because of my eyesight. So then I followed my second. I started following my second dream, which was to become a doctor. So that's the reason why I studied biology. And when I came to the States, I kept studying biology, but I wasn't able to go to medical school because I was a student at that point. I didn't have a residency. And so I evolved into technical communications and Latin American studies. And that's when I started working in translations and later on in interpretation and management of language services.
When you look back at your career and all the things that you've done, what are you proudest of?
I'm very proud of, well, all the help that I provided as a medical interpreter. I can tell you thousands of patients that I helped. And I'm also very proud of all the work that I did as a director of language services at MD Anderson, because through my interpreters and translators, we reached also thousands of patients, and we were able to help them in their journey through their illnesses.
That's awesome. And it's such an honor to have you join us for the Language Access Innovation Council. As you're thinking about I guess, the trajectory of language access over the last several years, since you started in the 80s and even before that, what have you seen be major shifts? Like, what's the driving, how are things changing over time? And what do you anticipate the future could look like?
Well, I think that the major thing, translation and interpretation has been has followed a very um, standard path because of the nature of the industry and the nature of the work we do as translators and interpreters. But the major um, developments have been in technology.
Mhm.
Back when I started, everything was done in person. Then we started having a lot of interpretation over the phone, and eventually we got to video interpretation. And so we have seen a lot of shifting into that direction, and interpreters being able to work from different locations and reaching more and more patients and being able to help more patients. And I think that's the way of the future, going into technology, improving technology in order to reach even more in a more efficient and effective manner.
As regulations have changed, how much have you seen that impact the way that people are thinking about and talking about language access?
Well, initially, when I started in the field, there were very few hospitals in the country that um, were really following all the regulations. It was, even though the regulations have been around since basically the late 60s,
Mhm.
um, there was very little enforcement, and it was very hard for many hospitals, especially medium to small size hospitals and healthcare organizations, to have interpreters or to provide the services because they're expensive. But as technology has improved, access to interpreters and translators has become more affordable.
Mhm.
So that has been the major shift into, using the technology to be able to provide better language access.
I know something that we've talked about informally as we're prepping for some of the council stuff is how the role of the interpreter might change over time and the role of language access might change over time. And so today, 20, 30 years ago, it was mostly on site. That was the modality that people were using. Transition to being more remote, where it was mostly telephone interpreting and then video remote interpreting. And now today there's more of an emphasis, or we hope that there's more of an emphasis on written translated materials and accessibility of those materials. So maybe it's a video, maybe it's something an in language, totally different experience that helps to create the same thing that an English speaker would have. But it's still very much just taking the journey that happens in English and interpreting it or translating it into another language. And we've talked about how in the future things might happen more designed for in language. Like maybe there's a totally separate IVR that you call in to schedule, and it's in your language designed for you. Or maybe there are opportunities to have discharge instructions and care plans that are designed in language using the notes from a different from English and designing those care plans into a different language entirely. Do you have thoughts on how that might, I guess it's a twofold question, how that might change the role of the interpreter and how they might be able to, might need to reshape that role or think about what that looks like as we're journeying to a future where we have different kinds of touch points that are made specifically for those who don't speak English as their first language. And then also what some implications might be for a health system that's considering making that change or designing specific journeys for specific languages.
Yeah, I think as we move forward and we incorporate more methods of, reaching or giving the right information to the patients in time, the role of the interpreter is probably going to move into more of an interpreter slash translator in some cases, because as you say, we're aiming
Mm-hmm.
to have more automated forms and documents and all kinds of informational resources for the patients in different languages. But also there are parts of, for example, discharge instructions that have to be translated uh, on the go. You
Mm-hmm.
know, usually discharge instructions are not prepared way in advance. And
Mm-hmm.
there are certain parts of them that can be automated and can be ready for delivery. But if a doctor writes a note at the last minute or within an hour of discharge, I think those interpreters are going to have to help and gain those skills to become more involved in the discharge process, for example. And the same with other areas.
Mm-hmm.
Instead of just being the interpreter who's there, verbally giving the information, I think the role of the interpreter is going to switch into a more active role where they translate some content as well. Um,
Total sense. And I think that it's a cool opportunity for interpreters too.
oh, definitely. And it's, I think there's a lot of fear right now in the community about losing our jobs as interpreters. I don't think that's going to happen. I think, yeah, I know the AI is out there and it's being developed, but I think interpreters are still going to be there for a very long time, are going to be needed. But as we are able to gain new skills and we are able to integrate ourselves into these processes even more deeply, we're going to make interpreters slash translators more important in the whole process.
Absolutely. I think there's an opportunity for interpreters, and I'm starting to see this happen, to start to think of themselves as not just interpreters or translators, but as their language uh, like conduit. Like that's, I know that's the word that everybody uses for interpreting, is that you're a conduit, but there's more to being a conduit for that experience than just interpreting or just translating. And so I think we might start to see a shift toward interpreters identifying more with the language access umbrella or language and cultural experience umbrella than with being an interpreter. Like that is how you ultimately, that's one tool that we use to achieve access and equity, but it isn't the aim. And so I think we're starting to see linguists of all different types identify more with language access and equity as a goal than with strictly interpreting and like the craft driven stuff. It's important to have people that are craft driven and that interpreters understand all of that, like how it progresses an interpreter. Also, it's important to understand the experience of the person that you're interpreting for on both sides and identify with how do I make that experience make sense to all people, which I think is part of the central ethos of being an interpreter. It's just like as technology changes, as things change, it might start to look a little different.
Exactly. I agree with you 100%. And m- you know, there are many interpreters who currently believe that all they have to do is go and interpret the medical session and leave. And
Mhm.
I think there are so many uh, um, different areas that the patient has to navigate when they're in a healthcare organization, that the interpreter needs to expand their role into, participating in other things as well, being an advocate for the patient, helping with other things that are not just medical, maybe finances, maybe counseling, maybe, um, support groups and things. And I think doing that, expanding our skills and expanding our being more flexible in the workforce is going to help us become even more necessary in the industry.
If you had one wish for the language access consortium of people, which I'm thinking of being not just those that work in language access and are interpreters or translators or language access managers, but everyone who's devoted to experiences of those who are limited English proficient or deaf and hard of hearing, which could be patient experience people, it could be even IT teams that are supporting the technology that's needed to get interpreters in place. If you had one wish for that community over the next 5 years, what would the wish be? What would be most impactful for that team, that community to focus on?
That's a great question, Francesca. And I think my wish would be for collaboration.
Mm-hmm.
Through the years, when I have been that I have worked in many roles, as I said before, and I have found that it's very hard to get different organizations and different teams, companies to collaborate. And I think the only way that we're going to make progress and bring technology to work more efficiently for us and make strides in the industry is by collaborating, sharing ideas, and allowing research to make the changes in the industry, changes that will make everything more efficient and more effective.
I love that that's your answer, especially because that's some of what we're doing together and making sure that there's a place for people to come together and talk about language access across different organizations, across different models, across different perspectives. So I love that that's your answer. And also, something that we've been thinking a lot about at Globo, I couldn't agree with you more about collaboration. And something that we've been thinking about at Globo is, and the reason why we created the Innovation and Experience Lab is that we're at a place, I think, in language access where we know that it's going to be disrupted to some extent by new technologies. Globo was founded, and I think a lot of language access companies were founded with different things that made us useful at the time. Globo's thing was and continues to be making sure that everything is centralized in one place so that you have access to insights and you can see that the marketing materials that you've translated are resulting in people calling in for that language and scheduling appointments. You can try to gauge that your language access program is working, and that all still absolutely holds. Also, we know that things are going to change over the next 5-10 years, and maybe even faster than that, because of some of the disruptive technology that's out there, and also just the way that our world is progressing and post pandemic and like just different things that are happening and the way that we're getting more connected and in some ways some of the things that mattered a lot 10 years ago don't matter so much right now. But what we're thinking about is how to create insights, how to generate insights from the population that's actually using the service. So absolutely the people inside the healthcare system or the government system or the insurance system, those that we serve, making sure that they're talking to each other and that we have a way to get insights as a community so that we know, hey, this is what it looks like to deliver really, really great service to your limited English speakers. And then also to the limited English proficient community directly and the deaf and hard of hearing community directly, which it isn't always easy to get direct access to those populations because you have to speak a lot of different languages in order to get access to, your top 15, top 20, top 30 languages. And so that's something that there's not a ton out there that's directly with all different kinds of language communities. You get a lot of like one language and cultural community as study, but you don't see it across a bunch of different communities. And so that's another thing that we're trying to do is get insights directly from the the patients or the members, the people that we're serving that speak a language other than English, in addition to those that are responsible for getting the interpreter on the call, in addition to, so like the providers and the administrators and all that, and then also the linguists themselves. Because if a linguist has a really great experience and is supported, we've always believed this, if the best supported interpreter is going to be the best at delivering what they need to deliver. The same is true for the provider. A more frictionless experience for the provider means that the patient is going to have a better experience. And so the way that we can design those things that are less frictionful, more meaningful interactions, support human thriving, is ultimately just by talking to people more. So I'm excited about that.
Definitely, I agree with you. And it's I have seen many systems and companies come up with their own solutions here and there and find, let's call them patches for different things. And the more we collaborate and think, brainstorm about what is needed, the better results we're going to have, and the more um, efficient systems we're going to find, efficient technologies and efficient methods we're going to find to improve the industry and improve language access for our patients.
And I'm a designer by training. I'm a human-centered designer. That's what I went to school for, and what I do on the day-to-day basis is trying to design solutions. And the first thing that they teach you as a human-centered designer is to be human-centered. You can't be prescriptive. You can't say this is what it seems like should happen, because we don't know. Like, we're not living it, and so putting the human that you're serving in the center and understanding from them, observing them, making sure that their experiences are understood and that they're designed for. That's the first way to making sure that things are meaningful. And as things change, you have to stay in lockstep as they change. And there will be a lot of change. And so how do we get ahead of that?
Yeah, no, definitely. We have to do that. And what you said is very important, listening to the different people involved in the process. If I, let's say, when I was as an administrator, tried to find a solution without listening to my patients and the staff in the hospital, the doctors and everybody else, uh, I'm gonna come up with a system that's great for me,
Mhm.
but as it may not be great for the patient or for the providers. So that collaboration, I think, is key, and it's listening to everybody is key to improving our industry.
Thanks, Cesar. My last question for you. Why are you involved in the Language Access Innovation Council, and what are your hopes for that council?
Well, I am hoping that we can gather experience and ideas from different people in the industry in order to improve what we have, in order to look at the future as best as we can and try to prepare for that. I think that we, mm, I can tell you, 20 years ago, we were barely looking at different methods, and video remote interpretation came up as an option. Well, 20 years later, we need to start looking at what's going to happen 5, 10, 20 years from now and start preparing for that. And the only way we're going to do that is by sharing ideas, by brainstorming, by listening, and trying to come up with the future.
I know I said that was my final question. You got me curious about one more thing. What do you think is the biggest barrier to collaboration and talking about language access across different health systems? And what's the biggest barrier to people working together?
Well, I see it as sometimes a fear of, giving somebody an idea and them taking it away, kind of stealing it away from whoever's involved. Um, and I think it should be the opposite. I think we should collaborate so everybody is able to benefit from those ideas. I think sometimes we don't share even data that could be beneficial for everybody because we fear, oh, they're going to do something with this or that or my ideas or my data. And I think, you know, if there is that fear, we can overcome that. We can have agreements that we're going to use this only for certain situations, for research, and and then when we come up with new products or new methods, uh, we can all share them and we can improve. So that's what I think is the main factor. I think we need to be a little more um, open, a little more transparent, and more, for lack of a better word, more collaborative in the area. So we all benefit from the improvements.
That is so true and so inspiring. Any final words for our listeners? Anything you want to make sure that we talk about that we didn't talk about?
Well, I would like to encourage everybody to participate in this kind of discussions. Globo is making a big effort to try to look at these issues and try to look at the future. I know that there's other companies who are also looking at those things in a more internal fashion, let's call it. But I think if we all go out there and meet and talk and brainstorm things, we will come up with several good ideas to work on and allow research in order to improve. So encourage everyone to participate.
Yes. Thank you, Cesar. Absolutely. And the council is not, as much as Globo is sponsoring it and we want to make it successful, it's not owned by us, it's owned by our community. And so we're going to do things in the world that are not specific to Globo, and it's really owned by the people who are participating. So if you are interested in participating, don't hesitate to reach out. The information for how to join will be in the notes below, and more information about when the council meets, and all the information that you might need. Thank you, Cesar, for taking the time to have this conversation. It has been an absolute pleasure, and I'm very much looking forward to our first council meeting.
Thank you, Francesco, for the opportunity, and I hope we can everybody listens to this. We can reach a lot of people who are interested in the future and in collaborating. And I think it's going to be very interesting and very productive, a very productive effort.
Very productive conversation. Yes.
Exactly.
Thanks again.
Thank you.
Well, thank you for listening to our conversation today, friends. Your contribution, no matter where you sit, can make the world a more inclusive, accessible, and kind place. Until next time, cheers to access and equity.